Hi, this is a patient who's now come for the first review after hair transplantation. We've done 3,500 grafts of follicles with the FUE, or follicular unit extraction technique, which is a scarless technique, sutureless technique, safe technique, and a permanent technique. Alright, we're going to have a closer look at how he looks. I've just taken the bandage off a few minutes ago, and this is how the donor area looks. Not sure if you can appreciate it. Yeah, I can get a closer view. So you see how beautifully it's healed in just over 3 days. This is because only the follicles are extracted. Even the epithelium that comes with that is very, very minimal. Therefore, the healing is very fast, almost instantaneous, rapid healing, right? That's the donor area. You would not know anything in another few days. I'm going to probably take a video again on day 7, so you'll appreciate that. And before we go on to the recipient area, I want to ask this gentleman some questions so you understand what's the kind of pain involved or how discomfortable, how the comfort issues. So how are you feeling right now?
Nothing.
You feel nothing, like just nothing is exactly. So that's the first thing. And 3 days, when you remove the dressing, patient feels nothing. That's his own words. He feels totally normal. All right. Any issues with your diet?
No.
Nothing. Any pain anywhere? No. So there's no pain. There's nothing. Now, how long did you feel pain, or did you ever feel pain after the procedure?
No.
So he's never felt pain. I know the surgery is pretty scary. A lot of our subscribers keep asking me, doctor, this looks like really scary. This looks so painful. But that's the patient's own words. I've time in and time out explained that there's going to be no pain. The reason is because we give anesthesia. Good local anesthesia blocks ensure that there is no pain for so many hours, and then the pain medications take over. So he's on pain medications. Now we've taken pain medication 3 days, right? So he's taking medications for 3 days. We're going to put in medication 2 more days, and then totally taper it off. So there's going to be no pain. Right, any other issues that you think you would want our subscribers to know? Like, were you anxious, apprehensive, or was anything at all an issue in the last 2-3 days when you went back home? Was it a problem to sleep?
Not really. I was worried about the sleeping patterns.
Okay.
But, it's not a big problem.
Not a big issue. He was worried a bit about the sleeping issue because I told him to sleep straight. We had done some grafting, even a little bit in the sides. So I didn't want him to turn on the sides, but when we do it only on the frontal area, patients can turn and sleep as well, right? Now the next visit for you is going to be on day 10, when we recommend you to take a shower and then come over. We're just going to do a little dressing. And now the other important thing, all these days after surgery till now, he's been using the spray. Can you just show the bottle first? It's just a small bottle with saline, and he's going to keep spraying this every hour. That's pretty much what he has to do. He can work from home, he can do anything else. Just making sure this is not dry and he's not in a very dusty environment. That's about it. No dietary issues, nothing else. Am I right? Cool. So thank you. But before I end up, I'm going to show you the recipient area. You can have a closer look to that. Probably see how nice the follicles are coming out. I'm also going to explain a little bit about our plan. So why in this area? Because these areas, its density was less, and the front row was all single follicle, and thereby we have stacked up 3 and 4 follicles, multiple follicles, so that the density is more. Also on this side, you can show here. Come show the vertex also. Come behind. All right. So you see, this is the vertex. So he already had a tuft here, so we went around that, gave the frontal band. And then we had extra follicles, and we also have given him some density till the vertex. So we've covered the entire scalp pretty much. And this is just day 3. It's looking very, very good. All right. So one last thing, the entire result takes up to 9 months. So it will take a while for this follicle to settle in this new location and grow from there. And I've seen it, for some it works even faster, can take up to 9 months before we see the final results. Yeah? Alright, thank you.